And while on the subject of John McCain, his campaign will release his medical records late tomorrow, giving a few reporters a limited look at those records. But we've already learned a great deal about what his health records will show. Our medical editor, Dr. Tim Johnson, helps explain McCain's health report. Tim, let's start with what you see when you look at McCain, a rather large scar on the left side of his face. What was done and why?
He had surgery in the fall of 2000 to remove a melanoma from his left temple. It was about the size of a nickel. Then they decided to dissect surgically down his face and into his neck to examine lymph nodes. They found no evidence of cancer. They made the decision not to do any further treatment. So he had a 2A stage invasive melanoma. The prediction for such a person is about a 30% mortality rate over the next 10 years. But the fact that he survived 8 years, say experts, is a very good sign. He obviously has careful skin examinations 3 or 4 times a year.
There's also an enormous amount of medical records involving the time that he was in captivity in North Vietnam to check to see what physical damage he suffered and maybe what psychological damage.
Well, he clearly suffered many orthopedic injuries. Upon ejection from the plane, he broke both his arms and a leg, and during captivity, the guards brutalized him. He suffered fractures in both shoulders and many ribs. So he clearly has some limitations of motion, especially in raising his arms. However, there's no evidence that those injuries have affected his activity level or his energy level. Now, the emotional part is harder to assess. He was carefully assessed by Navy psychiatrists for many years after his release. They found no evidence of any serious problem, and he strongly denies any symptoms of post-traumatic stress disorder.
But he's 71 years old. What do the actuarial tables say about a man who's 71 years old?
The actuarial tables say that if you make it to 71 in overall good health, your life expectancy is about 16 years. That would be to age 87. I think that's surprising to many people. It's much more difficult, of course, to predict any change in mental acuity. At age 71, there's about a 30% chance of developing serious memory loss or even dementia. But experts point out that with aging, maybe some skills such as judgment get better. So, Charlie, the old cliche is certainly true in this case. Time will tell.
Dr. Timothy Johnson.